I'd like to introduce to you Dr. Michael T. Murray, ND, naturopathic doctor. His topic is going to be nutritional and botanical approaches to periodontal health. Dr. Murray is widely regarded as one of the world's leading authorities on natural medicine. He is a graduate faculty member and serves on the Board of Regents of Bastyr University. He is co-author of a textbook of natural medicine, the definitive textbook on naturopathic medicine for physicians, and he has written over 20 books on nutrition. Please welcome Dr. Michael T. Murray.
Thank you. Good morning. It's a great pleasure to be here. I'm quite impressed with the agenda that you have before you the next couple of days. I know you've had a couple of speakers already. I really enjoyed looking through this booklet. I learned quite a bit. I want to start off today by telling you a little bit more about me and my history with this subject matter. I'm a naturopathic physician, a doctor of natural medicine. I am a graduate and served on the faculty and board of trustees, now the board of regents at Bastyr University. When I was going through Bastyr in the early 80s, it occurred to me that if natural medicine is based upon truth, that it should be able to stand up to scientific investigation. So I started collecting research articles from the University of Washington's Health Science Library. One of the great myths out there is that natural medicines aren't scientific. Well, the truth of the matter is, for most common health conditions, you can develop a stronger scientific rationale using diet, lifestyle modification, and natural products than you can for many of the drugs that are in vogue. So I was collecting all this research, and over the last 30 years I've collected nearly 60,000 scientific studies on the use of diet, natural products, herbal products, nutritional supplements, other natural ways to treat disease and promote health. And it's from this large database that I have written over 30 books now, and also been instrumental in bringing many safe and effective products to North America. How many people heard of ginkgo biloba extract? Yeah, if you haven't heard of ginkgo by now, you probably need to take some. Glucosamine sulfate, DGL, quercetin, curcumin, enteric-coated peppermint oil, virtually all the standardized herbal extracts, saw palmetto, St. John's wort, grapeseed extract, bilberry. These are just some of the products I helped introduce to North America. My interest in this field of periodontal health was kind of interesting. When I was a student at Bastyr, I had an interesting patient. This patient came in because she had systemic inflammation. She had what we thought might be rheumatoid arthritis because she had migratory severe inflammatory arthritis. And when you're a student in a clinical environment, they teach you to do a system review, and we did whole body physical exam. And her mouth, she had severe periodontal disease, and she had what looked like an abscess. So we referred her to a local holistic dentist, and sure enough, he had to extract the tooth. When he extracted the tooth, all of her systemic inflammation disappeared. And that got me thinking, and the question was, well, what happened? So that led to a research paper on the role of endotoxins and activation of the alternate complement pathway in the disease process. This is a tremendous reservoir, as you all know, for inflammatory compounds being produced. So then I had another patient, and this gentleman was relatively young. Back then I thought he was old. He was about 40. But he had pocket depths of like 8 and 11, and he had perfect hygiene, and he was seeing the dentist, and it was a holistic dentist, and the dentist had referred the patient to us to see if there was anything we could do. And we instituted a therapy that is very similar to what I'll be talking about today. And within 3 weeks, we were able to tighten up that tissue and reduce the pocket depths to about 2 to 3. So there's a lot that can be done from a nutritional and natural perspective. I think that we get so caught up in the modern world with looking at the infecting organism that we forget the role of the host. I'm not saying that bacteria and other organisms aren't important, what I'm saying is I don't feel that they are as important as the host. There's a statement that's attributed to Pasteur on his deathbed. And whether it's true or not, I don't know. But, Pasteur was really responsible for the development of the germ theory. And when Pasteur died, he realized that, as he was dying, that perhaps that he wasn't quite right, that maybe the germ wasn't as important as the terrain. And so often we get caught up in the germ that we forget that if we have a functioning immune system, if we have proper host defense mechanisms, that germ should never be able to find a strong enough foothold to be an infecting organism. One of the first chapters I wrote for a textbook of natural medicine was on periodontal disease, and I came across this article back in 1981, and I really like this quote. It says, "Clearly bacteria are essential agents, but their presence is in itself insufficient. Host factors must be involved if the disease is to develop and progress." So what are some examples of host factors? Well, we're basically talking about the environment of the gingival sulcus, and this is involving things like immune function. We know that periodontal disease is much more aggressive in people with impaired immune function. Lifestyle factors, we know this is true as well. If people smoke or drink excessively, they have an increased risk of periodontal disease. And then there can be local factors, amalgam restorations, malocclusions, and mechanical factors. I had some issues myself with periodontal disease. I had pocket depths of 3 to 5 on some teeth. Then a few years ago, about 10 years ago, I put braces on myself. And I didn't do it myself, but I mean, I got braces, and boy, all those pockets closed down. So malocclusions certainly are a factor. Mechanical factors definitely play a role. And the reason why they're so harmful and create the opportunity for periodontal disease is that they alter the structure of this collagen matrix that supports the periodontium and gingiva. So what are our key nutritional goals for dealing with periodontal disease? Well, we want to decrease inflammation and free radical damage, improve membrane and collagen integrity, decrease wound healing time, and enhance immune status. So everything I'll be talking about today in terms of diet and supplements relates to trying to achieve these 4 key nutritional goals. I like something that Dr. Baldwin said. I thought this was very interesting. I'm going to steal this. He said, people with gum disease are not healthy people with sick gums. I like that. And he says, if you're going to treat periodontal infection, you absolutely must treat the whole body. That's a good axiom. So what we know about periodontal disease is that it's not a localized situation. It's reflective of some processes that are going on throughout the entire system. We know that, for example, periodontal disease is most severe in people that have low antioxidant status. This is demonstrated by looking at the data from the National Health and Nutrition Survey 3, as I've offered the abstract here. So a low antioxidant status is associated with an increased risk for developing periodontal disease. So we'll talk about ways to raise a person's total antioxidant capacity. When the periodontal connective tissue matrix is under attack with a lot of free radicals or bacteria, it leads to severe destruction of that tissue, and that tissue is absolutely vital. This periodontal connective tissue matrix is important for serving as the periosteum to the alveolar bone. It allows for the dissipation of pressure exerted during mastication, and it acts as a barrier to the transport of large molecules and bacteria and other organisms into deeper tissue. And it's extremely vulnerable to atrophy. If you don't have enough nutrients that are responsible for making collagen and other connective tissue structures, or if that tissue is under severe attack, it's going to act as a very poor barrier, and you're going to get periodontal disease. We know for an absolute fact that periodontal disease is associated with poor wound healing, and that if you have poor wound healing, you have an increased risk of developing periodontal disease. So any condition that's linked to poor wound healing increases the risk for periodontal disease. And what's the classic disease that's associated with poor wound healing? Well, I would say it's diabetes, type 2 diabetes especially. Poor wound healing, very common. People that are on corticosteroids, prednisone, poor wound healing, increased risk for periodontal disease. We also know that poor immune function is linked to periodontal disease. So we see this in some conditions like Shediac-Higashi syndrome, a inherited condition where they have very poor immune function. They have an increased risk for periodontal disease. So it's well established that the severity of periodontal disease is inversely related to the status of the immune system. So we'll be talking about ways to deal with improving the immune system. Here are the key nutritional factors that I'll be talking on and how they relate to, I'll talk about how they relate to periodontal disease. Obesity, diabetes, and insulin resistance, sugar, vitamin C, zinc and copper, vitamin E and selenium, coenzyme Q10, and flavonoid-rich extracts. We've seen an epidemic of obesity, type 2 diabetes, and the metabolic syndrome here in the United States. If you look at this slide here, and we see that prior to 1990, the obesity rate was about 10%. And 98, it increased dramatically. 2006, we have a situation where roughly 1/3 of adults over the age of 25 are clinically obese, and roughly 8 out of 10 Americans over the age of 25 are overweight. There's a strong link between being overweight and developing type 2 diabetes. That's because as we gain weight, particularly around the abdomen, the fat cells start to secrete compounds that block the action of insulin. So impaired insulin action leads to elevated blood sugar levels and type 2 diabetes. So what's going on? Why do we have so many Americans that are battling the battle of the bulge, I guess? Well, I think a lot of it has to do with this. This is the old USDA food pyramid. I think if you look at the timeline, it seems like the introduction of this USDA food pyramid was really linked to the kind of the epidemic of obesity, type 2 diabetes, and insulin resistance. And I think the reason is that the USDA and other organizations were telling people to eat 6 to 11 servings of bread, cereal, rice, and pasta each day. You know, it's very hard to control your blood sugar levels if you're eating that much carbohydrate. So I think the government got tired of people referring to this pyramid as the government's guide to how to get fat and develop diabetes. So now they've converted it to this color-coded system, which nobody understands. It's not instructive at all. So you know, you really have to understand what they're trying to accomplish here, and they color-coded things, but I think I think that they're just trying to confuse us more than anything. In addition to roughly 20 million Americans with type 2 diabetes, we have 60 million Americans suffering from what is referred to as the metabolic syndrome. This is a constellation of signs and symptoms that include abdominal obesity, high triglyceride levels, low HDL, high blood pressure, and blood sugar levels that are in the pre-diabetic range, between 100 and 125. So basically, if your waist is larger than your hips, you're likely suffering from the metabolic syndrome, and you're likely suffering from insulin resistance. As I said, roughly 60 million Americans are associated with having this metabolic syndrome. And I've tried to simplify what I think is going on. It's basically a progression of the same thing. When we overconsume, especially carbohydrates, we start getting abdominal obesity. We get insulin resistance. So we get insulin resistance, we get central obesity. We used to think of fat cells as just being storage sites for excess calories. You eat a little bit more and it gets stored as fat and it just kind of sits there. Well, now we know that the abdominal fat is actually very much involved in our hormonal system. Now, at first I was calling it an endocrine organ. Now I'm calling it an endocrine tumor. When you start to gain this abdominal obesity, you start to secrete compounds that actually promote further insulin resistance and an increased appetite. And this tumor wants to grow. It wants to get bigger and bigger and bigger. So it's blocking insulin and it's stimulating you to eat more. So that's what's happening, is we got a vicious cycle going on here. We need to stop this cycle, and the way we do that is by promoting the improved action of insulin. That's really the key thing. I just wrote a new book. It's called Hunger Free Forever, and it's all about controlling your appetite. And one of the key things that we utilize in this program is a special dietary fiber blend called PGX. PGX stands for polyglycoplex. How many people have heard of the glycemic index? Probably everybody, right? Yeah. The same research team that developed the glycemic index developed this special dietary fiber blend. It's the first of what I think will be many types of super fiber. Basically, this fiber is able to bind more water than any other known fiber source. It binds about 600 times its weight in water. So when you ingest it, it forms this large gelatinous mass in your stomach. That slows down gastric emptying, flattens out the blood sugar response after a meal, and also tells your brain that you're full. If we look at the viscosity or water binding and thickening aspect of PGX, it's significantly greater than any other known fiber source. It's about 20 times more viscous than psyllium or Metamucil. So the advantage is you can take smaller amounts to produce a very large gelatinous mass in your intestinal tract. When you eat a low-fiber meal, lots of sugar, that sugar is immediately absorbed into the bloodstream in the first segment of the small intestine. That leads to a very high blood sugar response, insulin response, and eventually the insulin levels will drive that blood sugar down. I'll show you what we've been working on as it relates to controlling blood sugar. It's quite interesting. When you have a meal that has a lot of fiber, or if you take this PGX supplement, what happens is that it leads to an expansion in your stomach. It slows down gastric emptying, and the nutrients are absorbed slowly throughout the entire gastrointestinal tract. That leads to a flatter blood sugar response. And it also has been shown to lead to the release of various gut-derived hormones that tell your brain that you're full. Now, I know you're all thinking, what does this have to do with periodontal health? It has a lot to do with periodontal health, because if you are insulin resistant, you're going to have poor immune function, you're going to have higher blood sugar levels, and you're going to have poor wound healing, all which are associated with increased risk of periodontal disease. What we've been doing at the Canadian Centre for Functional Medicine, under the direction of Dr. Michael Lyon, is that we've been measuring 24-hour blood sugar measurements. So this is continuous blood sugar monitoring, and we've been measuring blood sugar. This patient was measured from midnight to midnight, and what we found is that most people that are overweight are on what we refer to as the blood sugar roller coaster. And anytime there's a rapid rise in blood sugar, it's offset by a rapid drop. And we found that when there's that rapid drop in blood sugar, there's a corresponding increased appetite. There are food cravings. So it's virtually impossible for people to achieve their ideal body weight if they're on the blood sugar roller coaster. Every time that blood sugar level goes up and starts coming down, the body responds by secreting a lot of cortisol. That'll raise your blood sugar levels, but it'll also create some problems. We found that we can utilize PGX and our dietary program and literally flatline a person's blood sugar control. If you can flatline a person's blood sugar control, you can control their appetite. If you can control their appetite, then weight loss becomes effortless. And that's the goal. If you can help a person get control over their appetite, they can lose weight and keep it off. What also occurs is you get improved insulin action. Now, this effect is absolutely revolutionary and novel, and I kind of very proud of it, and that's why I wanted to share it with you today. Because if you would have showed this to me before I knew anything about how this fiber blend worked, I would tell you that it would be impossible to produce this tight blood sugar control. But by doing so, the physiological ramifications are absolutely incredible. We have to eat to support blood sugar control. We have to eat a rainbow assortment of fruits and vegetables. We have to reduce exposure to pesticides and heavy metals by eating organic foods. Most of us in the U.S. need to reduce our intake of animal foods, eat the right types of fat, keep salt intake low, potassium intake high, and drink sufficient amounts of water each day. I've developed my own version of the food pyramid. I call it the optimal health food pyramid. And it's a bit different than what the USDA recommends. At the bottom, I've got good oils, vegetables. On top of that, I've got legumes, whole grains. I've got high-quality protein, fruit in moderation. Dairy is an option. We want to completely avoid high glycemic, starchy foods. We want to avoid hydrogenated oils and fried foods. This sort of dietary approach for good health, I think, is one that we all can attempt to follow. My diet pyramid is very close to the healthy eating pyramid from the Harvard School of Public Health. The difference is that I think I do a better job of defining what are healthy oils. And if you're here, they're recommending to eat vegetables in abundance. If you're recommending to eat vegetables in abundance, I think that's more important than eating whole grains. In terms of blood sugar control and helping people lose weight, I generally tell people to stay away from grains for a while until they get their body weight to where they want to be. If we look globally at the diets that are associated with the greatest degree of health, they are the traditional Mediterranean diet and the traditional Asian diet. The traditional Asian diet, this diet is associated with reduced risk for heart disease and cancer. And it's also associated with a reduced inflammatory mediators, as is the Mediterranean diet. The Mediterranean diet doesn't mean you eat more pasta and tomato sauce, by the way. It's a very well-defined diet that was consumed by people in the southern Europe, particularly Crete and in Greece and the lower parts of Italy. And this diet was very high in vegetables and plant foods and associated with significantly reduced risk for heart disease and cancer. When they've looked at the Mediterranean diet as an intervention, they found that it reduces systemic inflammation. The best measure right now for systemic inflammation is C-reactive protein. And I think it'd be a good idea, if you have a patient with periodontal disease, probably a good idea that they have a C-reactive protein test to see what sort of systemic inflammation might be taking place, because that periodontal disease could be contributing to that and vice versa. So what they did in this study, they used the Mediterranean diet as an intervention, and they saw significant improvements in various markers here of inflammation. This compound, adiponectin, this is really interesting. I mentioned earlier that as we gain weight around our abdomen, it changes the level of certain hormones that ultimately results in insulin resistance and increased appetite. Adiponectin is a good guy. It's a good fat cell-derived hormone. Resistin is a bad hormone. As people start gaining weight, their adiponectin levels start to decline and their resistin levels go up. If we can help them improve the action of insulin, then it just goes the opposite way. So looking at some of these markers and seeing changes with just switching people to a Mediterranean diet is very important. You've all probably heard the benefits of wine against cardiovascular disease. I like this chart here. If we look at the rate of cardiovascular disease, and that's showing you mortality rate here, it goes up. Okay, so we see, where's the U.S.? U.S. is right here. We look at Japan over here. We see France. So Italy and France, they drink a lot of red wine. So the French paradox has been used to describe this association between low rate of heart disease and high consumption of wine. Wine is this. But look over here at Japan. They don't drink red wine, so why do they have such a protective effect? Well, they get their polyphenols from a different source. They get it from green tea. Diets that are rich in these polyphenols, such as those found in red wine and green tea, are very important in reducing the risk for cardiovascular disease, heart disease, and these polyphenols, which I'll talk about in just a minute, are absolutely critical in stabilizing that connective tissue in the periodontium. So I believe they're very important in fighting periodontal disease. So if we look at the Mediterranean diet, we see that this is a very healthy diet. And again, it's very much focusing on plant foods and good oils. This diet has become one of the primary interventions in dealing with silent inflammation. Silent inflammation refers to the complex scenario involving many factors that are together linked to being an underlying feature in many chronic diseases. So if we look at silent inflammation, we see that it plays a major role in virtually every chronic disease. And I think that periodontal disease is a source of inflammation in many people and can therefore be an underlying contributor to these other conditions. Likewise, I think with situations like diabetes, atherosclerosis, you see increased risk for periodontal disease. So we need to eat to reduce inflammation. We do that by eating foods that are richly colored, very rich in phytochemicals. Here are some superfoods that are getting a lot of press. You know, cabbage family vegetables, spices like turmeric, dark-colored squash and other vegetables, kidney beans and pinto beans, blueberries, soy, non-gluten sources of whole grains, richly colored fruits and vegetables, tomato for the lycopene, walnuts for the omega-3, spinach for the lutein, and of course salmon for the omega-3 fatty acids. All important in reducing inflammation. One question I ask of consumers when I'm out there talking, of these foods, which has the highest antioxidant capacity? Well, they always say blueberries, but it's a trick question. The answer is red kidney beans. Red kidney beans have more antioxidant capacity, and these legumes, like kidney beans, are very important in helping stabilize blood sugar levels, and they're quite a healthy food. I always got a kick out of the patient that would say, when I would ask them to make some changes to their diet and get away from, I've had patients that had just horrendous diets, right? And you ask them to make some simple changes, and they say, "What can I eat? There's nothing I can eat. If I do away with my bacon and eggs in the morning and my Big Mac for lunch and my steak and potatoes for dinner, what am I going to eat?" Oh, there's a smorgasbord of delicious foods, and These are some of the examples of superfoods for good health. We've got to get people eating more of these foods. Doing so will bolster our antioxidant system and reduce some of that systemic inflammation. We need to avoid some of the factors that contribute to inflammation. These include trans fatty acids, a high intake of arachidonic acid, which we get only from meat and dairy. I tell people to stay away from omega-6 fats. You want to stay away from corn oil, cottonseed, grapeseed oil, peanut, safflower, sesame, soy, and sunflower. You want to cook with olive oil or macadamia nut oil. You want to stay away from margarine, stay away from fried foods and high saturated foods. And it's always a good idea to stay away from any food that has a longer shelf life than you do. Okay? So particularly crackers, pastry, chips, they still have trans fats, or they're very high in empty calories. These are examples of the good high-fat foods. Now, again, why is this important to periodontal disease? Well, we know that too much sugar is very detrimental in our ability to control blood sugar levels, but also important is not getting enough of the right fats. Studies have shown that when our cell membranes are packed too full of saturated fats and trans fatty acids, that they don't work properly. The way that insulin works in our body is to bind to receptors on our cells and then open up channels that allow glucose to come in. When our cells are too packed full of saturated fats and trans fatty acids, insulin doesn't bind very well. There's a reduced number of insulin receptors, and there's a reduced number of these channels. So if we eat too much of the wrong fats, that too can contribute to type 2 diabetes. On the flip side, the good oils are the monounsaturated fats, again, that we get from olive oil, but also nuts and seeds. One of the most healthy habits that people can get into is to increase their intake of monounsaturated fats within moderation. About a quarter of a cup or a small handful of nuts and seeds each day is a great way to increase the intake of those monounsaturated fats. Now, you all are probably familiar with the benefits of omega-3 fatty acids. Omega-3 fatty acids from fish have been shown to be very important in preventing cardiovascular disease. And in fact, the level of these omega-3 fatty acids in cell membranes is associated with a more significant predictor of whether or not someone's going to have a heart attack than cholesterol levels, C-reactive protein, or any other known marker. This measurement is called the omega-3 index, and the level should be above 8% of EPA and DHA. Those are the two main omega-3 fatty acids from fish oil. Now, we can't rely on fish to get this intake. Why? Well, you all know this. It's because of the heavy metals, the mercury, lead, and other heavy metals that are in fish, and also the pesticide residues. This slide is showing you the omega-3 content, the EPA and DHA content of fish. That's in the blue and orange bands, along with the black band, which shows the methyl mercury content. Now, this ratio or this level of methyl mercury is really dependent upon where the fish is collected. Wild Alaskan salmon, for example, has typically very high levels of omega-3 and very low levels of methyl mercury. In some of the studies where they were looking at the methyl mercury content of salmon, they could not detect any methyl mercury, so very low levels. Other fish, very high. So in general, people are being told don't eat more than 2 servings of fish per week. I think that's a good recommendation unless you know that you're eating, for sure, fish from more pristine water like wild Alaskan salmon. Now, how do you get the level of omega-3 fatty acids that you need? Well, you get the level you need by supplementing with a good, high-quality, pharmaceutical-grade fish oil. One question I always get from consumers is, well, how do I know if I'm taking a good one? For me, it's simple. If it has my picture on it, it's a very good fish oil product. But, the key thing is that we hear this term molecular distillation. That doesn't really mean that much. The key thing is what sort of quality control standards are in place by the manufacturer. Is the fish oil manufactured in a certified drug manufacturing facility? What are the quality control standards that ensure purity and potency? If you have a good high-quality fish oil, then you need to take enough of it to provide that threshold of benefit. And that threshold of benefit is achieved at 1,000 milligrams per day of EPA and DHA. That's a combined amount. That's a great way to reduce your systemic inflammation. It's a great way to reduce your risk for those major killers. Back to periodontal health, there are 3 key supplements that I think are absolutely essential. One of them I just mentioned, a high-quality fish oil. The next is a high-potency multiple. And finally, we'll talk about some flavonoid-rich extracts. Vitamin C is well known in its importance to the gingiva and periodontal tissues. We have to ensure optimal vitamin C status in patients with periodontal disease. Subclinical vitamin C deficiency has been shown to play a significant role in periodontal disease in some patients. So, you know, vitamin C is inexpensive. If you recommend a good high-potency multiple vitamin and mineral formula that should provide sufficient levels, I would think you want to be at least 250 to 500 milligrams per day in someone with periodontal disease, even more if they also are continuing to smoke. In patients with diabetes, the insulin resistance may lead to decreased levels of intracellular vitamin C. The reason why I spent so much time talking about insulin resistance and diabetes in this talk about periodontal disease is that it's my belief that that's one of the key factors in kind of our erosion of health in America, insulin resistance. Because when insulin is opening up those channels, it's not just glucose that enters the cell. It's also many nutrients, many water-soluble nutrients, including vitamin C. So low levels of intracellular vitamin C in patients with diabetes is one of the contributing factors to poor immune function and poor wound healing. So if someone has insulin resistance, I think that they're going to be setting themselves up for a lot of serious health conditions, including periodontal disease. We know that vitamin B complexes can help improve wound healing in periodontal patients. Here's a study that was done 3 years ago where they had patients receive flap surgery, and they were given either a placebo or a vitamin C, B vitamin complex. When they looked at the data, what they found was that those that got the vitamin B complex had significant improvements in clinical attachment levels. So again, a good high-potency multiple vitamin and mineral formula should provide ample levels of vitamin B complex. Calcium and vitamin D have also been shown to help with periodontal disease. In this study, they looked at calcium and vitamin D and its ability to reduce tooth loss in the elderly. There's a lot of research coming out on vitamin D right now. You may have been seeing this in the news. Vitamin D, we used to believe we get plenty of it from the sunshine. But they did a study where they looked at people in Hawaii that were exposed to sunlight for more than 20 minutes a day without sunscreen, and they found that they had a high percentage of vitamin D insufficiency. Vitamin D is, it's kind of the hot nutrient right now in terms of research. They found that when they looked at women that received vitamin D versus those that didn't, that there was a 7% increase in life expectancy in the subjects that received the vitamin D. It has a lot of health-promoting effects. So the question was, how is vitamin D promoting life extension? And what they found was that each time our cells divide, the ends, the telomeres, shorten. And that shortening of the telomere is really what is responsible for determining our lifespan. And it's kind of like our biological clock. And vitamin D was actually able to prevent that shortening of the telomeres. So there's going to be even more and more research on vitamin D. Can you imagine if a drug was shown to increase lifespan by 7%? It'd be a huge thing. But nonetheless, there is a lot of interest on vitamin D, and we know that vitamin D can help prevent osteoporosis. If you have osteoporosis occurring in the jaw, you're going to have periodontal disease. So very important to get on a good calcium and vitamin D regimen, especially in women, to prevent future periodontal disease. Of all the nutrients that are important in periodontal health, you could make a strong case that zinc is the most important. It's probably the most important nutrient for an intervention. Zinc is critically involved in the structure of collagen, and low zinc levels are very common in the United States. And low zinc levels have been shown to be associated with increased inflammation and destruction of collagen tissues. We know that zinc is very important in the functioning of the health of the gingiva and periodontium due to numerous factors. And I've listed these up here: stabilization of membranes, inhibition of calcium influxes, antioxidant activity, inhibition of plaque growth, inhibition of mast cell degranulation, numerous immune activities, including increased neutrophil chemotaxis and phagocytosis. And zinc is very important in reducing wound healing time. Again, a good high-potency multiple vitamin and mineral formula should provide ample levels. I don't think you need to go high doses of zinc. 20 to 30 milligrams is sufficient in most cases. There may be some advantages to using zinc locally, either in a wash or some of these zinc lozenges that are used for the common cold. There may be a local effect that's very important. In terms of antioxidant therapy for periodontal disease, my focus is first to gain most of those antioxidant benefits through diet. And then next is that we want to make sure that we're providing a broad spectrum of antioxidant protection by taking a good high-potency multiple vitamin and mineral formula. If a person needs additional help, then in terms of periodontal disease, I would recommend coenzyme Q10. Coenzyme Q10 is to our cells what a spark plug is to a car's engine. It's very important in the production of energy. It also has some very unique antioxidant activities. There is some clinical documentation of benefits with coenzyme Q10 in the treatment of periodontal disease. There have been a few, I think about 3 clinical studies. These were very small studies, and they've been criticized by others as not being very well designed. But unfortunately, with many of these natural products, there's financial obstacles to doing the necessary research. It's not like getting the research monies for drugs that you can then patent and develop and recoup all that investment. So with CoQ10, we do need to see more definitive studies, but I think the scientific rationale merits its use. And I think 100 to 200 milligrams of coenzyme Q10 in a soft gel capsule in a lipid base, rice bran oil, for example, would be very important in the treatment of periodontal disease. As far as additional recommendations, I love flavonoids. I really do. Flavonoids are plant pigments that are responsible for the colors of many plants, flowers, fruit, and they're also responsible for tremendous actions of protection in our body. Flavonoids is a group of compounds that have been referred to as nature's biological response modifiers. Many medicinal plants owe their benefits to their flavonoid components. As a class of compounds, these molecules are referred to as nature's biological response modifiers because they modify our response to the environment. And this is noted by their antioxidant, anti-allergy, anti-inflammatory, antiviral, and anti-cancer effects. In regards to periodontal disease, flavonoids exert significant benefits on the connective tissue matrix. They increase vitamin C levels, they decrease membrane permeability, they prevent free radical damage, they inhibit enzymes that are released by bacteria that can lead to destruction of connective tissue structures. They inhibit mast cell degranulation, and they are able to cross-link with fibers directly. When I told you that story of the 40-year-old patient that I had that had severe periodontal disease, I used in him a flavonoid-rich extract of hawthorn berries, and it was in a soft extract form. It was kind of like a jam, but it was really concentrated for these flavonoids. And I had him take it by mouth, and when you take it by mouth, you know, his whole mouth would turn bright purple because of all these flavonoids. Well, I think they're very important in nourishing that tissue. You don't need to know the structure of these compounds. I've tried over the last 30 years to get across the concept of using flavonoids as tissue-specific antioxidants. As a class of compounds, these molecules are very unique in their antioxidant capabilities. When we hear the term antioxidant, what I've noticed is that most people think that all antioxidants behave the same. They don't. Antioxidants are like musical instruments, and you want to have the whole orchestra. What's so unique about these flavonoids is they exert a broader spectrum of antioxidant capacity compared to any other plant compound. You know, the carotenes, beta-carotene, lutein, lycopene, they have a very narrow range of antioxidant activity. Vitamin C, very narrow range. Vitamin E, even narrower. So these flavonoids are effective inside cells, outside cells, against fat-soluble pro-oxidants, against water-soluble pro-oxidants. So it's very important that we increase our intake of these flavonoid compounds, and we can do that through diet, and we should also be doing it through supplementation. For patients with periodontal disease, general rule of thumb, I would recommend 300 to 600 milligrams of a flavonoid-rich extract. So what I've tried to get across is that different flavonoids have an affinity for different tissues. So we can use flavonoids as tissue-specific antioxidants. Some flavonoids, for example, quercetin, has an affinity for mast cells that line our intestinal tract, so it's best for allergies. Bilberry extract, or blueberry, European blueberry, it has an affinity for the retina, so it's best for macular degeneration and diabetic retinopathy. Grapeseed extract has an affinity for the vascular lining. You got some really interesting presentations that will be coming, I think this one's tomorrow, on endothelial cell function. These flavonoids, particularly those from grapeseed and chocolate, really have a strong affinity for that tissue, endothelial cells. Milk thistle extract, very useful for the liver. Hawthorn extract, very useful for the heart, probably the best for heart disease. Green tea extracts, kind of your best overall best bet for cancer prevention. And ginkgo biloba extract, your best choice for cerebral vascular insufficiency. My key point is that you can match up these tissue-specific antioxidants based upon a person's need. In periodontal disease, I think getting these extracts in a vehicle that would allow local delivery is probably the best way to go. Topical treatments with flavonoid-rich extracts have been shown to be quite helpful based upon some of the research studies. These studies have used green tea catechins and pine bark procyanidolic oligomers, or PCOs. So I think you're going to get better results if you can get a localized delivery. In the case of that 40-year-old that I mentioned, I used a hawthorn extract from Scientific Botanicals. But I'm looking at this and I'm thinking, oh, there's a really big need for delivering these flavonoid-rich extracts locally, so I'll probably develop a product to do that. Makes sense. This is one of the last studies that I have on the screen for you, and this was interesting because they used an extract of centella and pomegranate extract. Centella is gotu kola, and it has some really interesting effects on connective tissue. It's probably one of the most powerful herbal substances to improve connective tissue matrix, and in this study they used it in conjunction with pomegranate extract. They used it, and I'm not familiar with this technology, but they used it as, in the form of chips that they would place in these pockets, and they showed significant improvements in the level of inflammatory cytokines and clinical improvement as well. So I wanted to have plenty of time for question and answers, but typically I got excited about certain things and went off on certain tangents, but I would like to open up the floor to just a couple of questions, and that's the time now. Yes?
Can you tell us the difference between a vitamin C complex and ascorbic acid that's very commonly used?
Okay, so the question is, what's the difference between vitamin C and ascorbic acid? Yeah, they're the same. It's identical. One is a vitamin C complex, and one is a synthetic vitamin. Yeah, vitamin C complex. Usually that consists of vitamin C along with some bioflavonoids. That's most often what you see. Yes.
For those patients that are vegetarians, the omega-3 fatty acids, is there another place to get them from?
Okay, everybody heard that question. Yes. For vegetarians, they can use some of the plant-based omega-3 fatty acids like flaxseed oil. But I would also recommend that they would then take algae form DHA. The reason is that the alpha-linolenic acid that's in flaxseed oil is a short-chain omega-3 fatty acid. To gain the benefits in reducing the risk of heart disease and strokes by 47%, to gain the benefits in the reduction of inflammatory mediators, you need to see that short-chain omega-3 fatty acid be converted to the longer-chain omega-3 fatty acids, DHA and EPA and DHA. That doesn't happen very well, particularly in men. Women are a little more genetically advanced in some forms because they have to, propagate the species, so they're better able to convert that short-chain omega-3 fatty acid into the longer-chain omega-3 fatty acid so that the fetus has that important brain nutrient. So for vegetarians, I'd recommend 1 tablespoon of flaxseed oil per day and an additional 200 to 300 milligrams of DHA. Yeah. Oh, sorry.
Coconut oil, anti-inflammatory properties of coconut oil, or is it a good fat, and is it good for cooking?
Coconut oil is a source of medium-chain triglycerides, and these saturated fats are utilized by the body different than the longer-chain saturated fats that we see in meat and animal products. These short-chain or medium-chain triglycerides are kind of like kindling to a fire, whereas the longer-chain saturated fats are kind of like wet logs. So you'll see a lot of people promoting coconut oil as a weight loss aid. Well, they're kind of misconstruing the data. What the data shows is that if you use an equal amount of saturated fat from butter and coconut oil, that those that are getting the coconut oil will not gain as much weight as those that are getting the butter. So anyway, as far as cooking with it, there's a lot of misinformation on that as well. It's okay to cook with, but you want to cook very short and at fairly low temperatures. It has a smoke point that's actually less than olive oil. The best cooking oil, in my opinion, is macadamia nut oil. It tastes really good. You know, with with olive oil, especially if you bake with it, everything kind of tastes like olive oil, which, you know, you don't want that in your cookie. But with macadamia nut oil, it makes everything have very, very nice flavor. So, and you can find that at your local health food stores now. Okay, who's got the?
I've been told that the lunch meal is ready,
Okay.
so that we'll have to save the rest of the questions for the forum.
Oh, very good. Oh yeah, yeah, okay. I forgot to read this this disclaimer. It says, I do not have any financial interests of a product in my talk or with any companies offering grant monies for this continuing dental and medical education program.